Hello, everyone. Thank you for joining us today. Welcome to the Avexia webinar series. Our topic for today is 24-hour urine hormone ultimate profile. My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your host for the webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Dr. Terra Sowinski, who will be our presenter for the webinar. Dr. Terra received her doctorate in naturopathic medicine and certificate in natural childbirth from the National College of Natural Medicine in Portland, Oregon. Dr. Terra uses a variety of natural methods custom prescribed to optimize each patient's health. These healing modalities include dietary and nutritional counseling, herbal medicines, homeopathic remedies, hormone replacement therapies, and physical medicine techniques. Dr. Terra has a special passion for the endocrine system and advanced training in natural hormone balancing for men and women. From hypothyroidism to infertility, diabetes to menopause, she is constantly searching for new ways to restore health. Dr. Terra is also a licensed midwife in Washington State and has traveled to Bali, Indonesia, and Vanuatu in the South Pacific as a midwifery volunteer, helping to provide safer births for patients with limited access to care. Without further delay, I will now turn the webinar over to Dr. Terra.
Hello, I'm Dr. Terra Sowinski, and today I'm here talking about the 24-hour urine hormone comprehensive ultimate from Meridian Valley Lab. The goal today is to help practitioners assist their patients with optimal health and hormonal healing, and just to provide an introduction to the 24-hour urine profile. I'd started by providing a quick reference outline so that you can jump to anything that you found clinically significant as we're talking, and it's referenced for the slide number. So why are we going to use this 24-hour urine profile? We can use it across multiple age ranges for both males and females. You'll see here that we've got the younger patient and the older patient, and you can use it to evaluate cancer risk in both of them. You can also look at prevention or treatment options for osteoporosis, among other hormone-related ailments or things that need to be treated. In the older patient, you can also look at specifically anti-aging and track hormone therapies that you might have the patient on or that they're coming in with. As well as we can look at stress and adrenal fatigue. In the young patient over here, we can look at growth hormone as well. We look at that for anti-aging also, but if there are growth concerns, we can look and see if that is an issue. There are some advantages to the 24-hour collection specifically. When you take the whole 24-hour collection, you're not going to miss something in the circadian rhythm that is off, such as a big spurt of hormone that is released. So collecting all of the urine for that 24 hours can be extremely beneficial compared to a 4-point, which can be useful for other things. Collecting pee is also non-invasive, and the GC mass spec is the top of the line testing. So we know that we're getting excellent results and things we can use for our patients. So let's do a sample run through. I'm just going to go through and talk to you about each of the metabolites and point some things out that you can talk to patients about. The first page is looking at your estrogen assessment. So there are a couple of things here that I'm just going to highlight. This first section here is your main estrogens. So you've got your estrone, estradiol, and estriol. Those are the most active estrogens that we use to evaluate basic hormone treatments. You will give estradiol and estriol if you're doing BHRT. Also, we have the phase 1 metabolites. That's the second section here, looking at the 2-hydroxyestrone, 16-alpha-hydroxyestrone, and 4-hydroxyestrone. These are going to be important in phase 1 liver metabolization, and also looking at things like cancer risk and osteoporosis. The last section here is the methylation section, phase 2 metabolites, and that's also going to be important as far as deactivating those really active estrogens and looking at cancer risk. The next section is going to be graphs. So this top section here, let me highlight that again. So this whole section here, that's going to look at the estrogen balance. So these are your main estrogens, your estrogen ratio with your E3 compared to your E1 and E2. Optimally there, we want it usually around 1 or above, indicating that you have plenty of E3 and you have a lower cancer risk that way. Same here, we've got the next phase, the hydroxylation. So comparing our 2-hydroxy estrone and the 4-hydroxy estrone and the 16-alpha hydroxy estrone. So again, cancer risk, this at the bottom here is the optimal, and then this would be patient results. And then lastly, we've got that phase 2 metabolism in this little gauge, looking at methylation status. Obviously, we want that really green to deactivate anything that might be cancer causing. So in this particular example, it's a little low, maybe an indicator of methylation need. At the bottom of this page, we're going to be looking at progesterone. Progesterone metabolite is the one that is stable in the urine to evaluate progesterone balance. You would be looking at progesterone, wanting it basically in the green levels, regardless of where you are. If someone is not on hormones, you're looking at the postmenopausal range. And if they are on hormones, we're actually using luteal, or if they're a younger individual. All right, next is the androgen assessment. We're looking at your DHEA, testosterone, and the things that they turn into: androsterone, ethioclanolone, 5-alpha androstenediol, and 5-beta androstenediol. So these I like to group in their two little sections. So again, if we're looking at the DHEA, we're looking at all of these, this range here. And this particular example is a little bit low across the board. So we've got low DHEA, low metabolites. And so that might be someone who would benefit from some DHEA therapy, remembering too that your DHEA turns into testosterone. So if testosterone are really high in that situation, you'd want to maybe be a little more conservative. Testosterone also, you're looking at metabolites. So we're looking at these metabolites and testosterone itself. In this example, again, it's a little bit low. So this would be someone who may benefit from testosterone therapy. These metabolites are also going to help us evaluate 5-alpha reductase, which we will talk about in a minute. The adrenal assessment is the bottom part of the page with the androgens on it, and it's divided into two as well. We've got the glucocorticoids here, and then we've got mineralocorticoids at the bottom. The glucocorticoids are going to tell us kind of more of your acute stress reaction or short-term stress. We've got your actual cortisol, cortisone, and then some metabolites of cortisol, which is considered a type of adrenal reserve. If you're not having a high level of cortisol, it's an indicator, as you can see here, of a production of about half of what you produce in cortisol per day. So if that's low, you're not producing very much, and you're headed towards adrenal fatigue. The mineralocorticoids are more of a long-term look at what's going on. So if these end up low, that can be a problem of more chronic adrenal fatigue or a severe compromise of some kind, as this also mentions. So in this particular example, we're looking a little low on metabolites, maybe headed towards adrenal fatigue, but not super chronically low. We've got one that's low here. So this person, whoever they are, could probably use a little bit of adrenal support. Next, we're going to be looking at enzymes. The top of this page looks at 5-alpha reductase. So that has to do with your androgen metabolism. And when that's high, that's a concern for PCOS and prostate concerns. A lot of women will tend to get more acne. And if we're having a lot of conversion to that DHT, which is what this does, then we'll have more male pattern baldness, and they will also get acne. You might also notice just more testosterone symptoms like aggression or feeling more short with people. In this particular example, I would call this pretty normal to low. If you average those out, you're going to be kind of right across that yellow to green. For a female, that's often a very nice place to sit because they will not get those symptoms of acne. For males, you might want to be more midline, so kind of in this section, which means they'll get some of that active DHT, but they will not be getting any other adverse effects. Really important to monitor that in your prostate patients. 11 beta HSD is your cortisol cortisone ratio. So you want that, again, right down the middle. That would be ideal, right down the middle. So this person, whoever they are again, is close. When you're looking at something that's very high, that would be an indicator of a lot of cortisol. And that would be an indicator that the enzyme is not working particularly well. And so that's correlated with, you could be over-treating with licorice. You could have a hypertensive patient that is adrenally related, also related to insulin resistance. All right, and then this page also has thyroid screening on it. Again, I use urine mainly for screening of thyroid. So if this is low, which this person's kind of low normal, might be an indicator to do a little more history on the thyroid and maybe do a more complete blood panel to get a full evaluation of what's going on with their thyroid. Melatonin, oxytocin, and growth hormone will also be on this page. Those are your pituitary hormones. So if all of those have an issue, that could be a problem that you might want to look a little further into, especially if everything is high. In this case, we've just got high melatonin, and melatonin often will look high when patients are taking melatonin, tends to accumulate more in the urine. Oxytocin and growth hormone are great anti-aging hormone evaluators. We did talk about the young person maybe also wanting to evaluate growth hormone if they're having growth problems. Metabolic disease, we're looking at two markers, the kynurenic and xanthurenic acid. So again, we'd want this guy right down the middle or in that lower quartile. And that would be consistent with a lower risk of metabolic issues in general. When it's high, so if it's over here in this section, we would be looking for potentially a B6 deficiency or some of those blood sugar issues. So if someone's eating a lot of sugar, they might tend more to have an issue than someone who has a lower kynurenic and xanthurenic acid. This page also has taurine on it. Taurine is one of my favorite markers on the test because not only is it a cardiovascular disease marker, but it is very good for energy production. It's anti-cancer. It is anti-aging. People with optimal taurine, and optimal taurine is actually about 2,000. So that's going to end up being right there. Whereas this person's very high, they're probably taking some. So you will live longer if you get to optimal. So 2,000 or above, you're going to be outliving the rest of us. All right, so now let's look at some more clinically significant things related to specific conditions. So these are going to be groupings of hormones that you want to look at or be on the lookout for to make sure they're balanced when people come in with these conditions. So that's cancer, osteoporosis, orgasm issues, and just for healthy aging in general. The cancer-specific analytes, you can see them here: estriol, 2-hydroxyestrone, and 16-alpha-hydroxyestrone, the 2-methoxyestradiol, the progesterone, the testosterone, and the taurine. I'm going to point out just a couple of these. Estriol is one of our main estrogens. When that is optimized, we do see lower cancer risk. When it's low, it's often an indicator that there's some iodine need. And so iodine is actually anti-breast cancer as well. So you might consider looking at that for that iodine need. The 16-alpha-hydroxyestrone is an important one. If it is high, that is an indicator that there may be a higher cancer risk, especially if the 2-hydroxyestrone is on the low side. We call that the 2:16 ratio. And so when that ratio is low, that is not a good thing for cancer risk specifically. And if you're just looking at the individual metabolite, the 16-alpha hydroxyestrone. 2-methoxyestradiol, also really important. That is one that we actually can use therapeutically to help shrink tumors, not just cancerous tumors, but other tumors like fibroids and abnormal growths like endometriosis. Taurine, again, I highlighted that as one of my favorites. That guy is great for cancer as well and will help patients have more energy. Osteoporosis specific analytes. So you'll notice estradiol, the 16-alpha hydroxyestrone, again in this profile, the progesterone, testosterone, and taurine. So we've got a few repeat offenders here. Important to note about that 16-alpha hydroxyestrone. In this case, you don't want it too low. So there is a sweet spot for 16-alpha hydroxyestrone. You want that 2:16 ratio, optimally between about 2 and 4. The reference range is a little bit bigger, but if it's 2 to 4 and you've got enough of this, it's not high, and the 2-hydroxyestrone is in good balance, you're going to have good bones and low cancer risk. Estradiol is important for your bone building, so your progesterone, your testosterone, all really important. We have to have those hormones to make good bones. And when you have the hormones, you can go do the other things and it will support your bone production. Orgasm-specific analytes, one of my favorite things to help patients with, because everyone should have an orgasm. And markers to balance here would be your estradiol and estriol, especially in those ladies. But if those are high in men, you definitely want them lower because they're not going to be as easily getting to orgasm. These are going to help with tissue integrity. So you're looking at vaginal dryness and just general integrity of the mucous membrane. Estriol and estradiol tend to help us ladies feel like we're ladies as well, which is going to increase the likelihood of having sex in the first place and getting to orgasm. Testosterone will do something similar. It's going to help with that tissue integrity and the moisture, but testosterone applied specifically to the clitoris has been noted by some patients to improve orgasm. And then for men, testosterone is just important for getting an erection so he can get to orgasm as well. Oxytocin is one of my faves for orgasm. This can be applied topically. It can be a nasal spray. You can also make an oral version of oxytocin, and you can take it around sexual activity or just as a daily dose to get you closer to that point. So if that is low, it's a great therapeutic option for individuals who are having issues with orgasm to play around with. And then lastly, we're just going to look at the healthy aging specific analytes. You can see here the estriol, progesterone, testosterone, taurine, growth hormone, and then the kynureninic and xanthurenic acid. So you want to really balance out your main hormones, specifically the ones that are going to help with tissue integrity and are anti-cancer. That helps you live longer. The taurine we've talked about already multiple times, and it really does help you live significantly longer than individuals with low taurine. Growth hormone helps you repair your tissues from the stresses of the day, and then keeping that kynureninic and xanthurenic acid in check and making sure that metabolic disease processes are not happening is consistent with living longer and having less oxidative stress from glycosylated end products. Okay, so now that we've gone through the test, when do we do the initial test and when do we follow up? For a younger person, you might do the initial testing just based on hormone symptoms specifically. If they're closer or getting close to menopausal age, maybe within 10 years, you might want to get a baseline so you know where they're supposed to be when you're looking at hormone therapy. You can also use this as a fertility baseline, or if cycles are just maybe a little off, you can optimize cycles using this. You can also evaluate adrenal function. So follow-up testing, if I'm treating a patient where we're trying to correct cycles, we're going to do about 3 cycles, so about 3 months out approximately of treatments before we'd retest. Some people might need to go to 6 months, depending on how quickly the treatments are being initiated and used. If this patient is already looking pretty optimized, we might just do every 6 months to a year to evaluate cancer risk. But if there's really no concerns and we're just getting a baseline, every 3 to 5 years would be completely reasonable to track hormones, and as they're getting closer to menopause or just generally aging, making sure hormones are not declining. In an older person, again, we might still get a baseline. It would be more of a baseline for either pre-hormone therapy, or if someone's coming into your practice on hormone therapy, considering that, or in perimenopause, things go a little awry. We might need to adjust therapies, not just according to symptoms, but also making sure that those levels are staying in physiologic range, so it is a safe hormone therapy. Again, you can evaluate adrenal function as well. And then follow-up testing for the average hormone replacement anti-aging patient would be about once a year, once they're balanced out. You might need to do it sooner if there's some symptoms, or if you just want to make sure you got everything in a physiologic range. Sometimes patients don't notice either a huge change, or they have a huge change, but they feel really good, but sometimes hormones are still not quite balanced. So looking at levels and symptoms would be appropriate, and correlating and treating the patient. All right, I also included a few extras to help you get started, so you can use these as reference for anything you need. This first one here is, I'm going to move myself, there we go, just a simplified steroid metabolism pathways. This is a great thing to have next to you when you are looking over the hormone test for the first time or the 100th time. You'll start to memorize this, so you won't need it as much, but it can really help you look at the pathways and treat the whole trickle-down effect of what's going on with these hormones. In some people, it's really needing to give precursors, especially in those young patients, and this will help you not only evaluate like what might be a precursor. So for instance, this is a very simple example, but pregnenolone turns into progesterone. And so that's the most direct metabolite there. And so if progesterone's a little bit low in a young person, you might consider just giving pregnenolone and having their body optimize and make more progesterone. It might have just needed a little pregnenolone. So keep this with you, print it out. It's a great reference. All right, and then it's always helpful to have your sample collection instructions as well. I want to point out this guy down here is a reference for females who are cycling based on their cycle length. What day is best to collect in your cycle? So if you have a 28-day cycle, best day to collect 19, 20, 21. If you only have an 18-day cycle, maybe 9, 10, or 11. You can also have them do a basal body temperature chart and look for ovulation. We are looking for, about a week post ovulation, unless you are pretty sure they just have a short cycle altogether, in which case you would reduce the time after ovulation. I put a sample prescription here just for anyone that's new to hormones. If you're prescribing, this is kind of how you would write the prescription. A couple of caveats here. This is just our typical biased prescription. So 80% estriol, 20% estradiol. This is the base or the cream that it's put in, and then the strength over here. A typical way to apply it as well. Most people apply the hormones to the labia, and it is important to remember that testosterone will be a similar prescription, so a similar milligrams per milliliter, but for females, but for men, it's going to be a much higher dose, and also progesterone is going to be a much higher dose for females, in which case you're going to have to increase the amount of cream that it's in. You can only get about 20 milligrams per 0.1 ml of your progesterone, or really any hormone, before it starts to not really absorb well. We usually do a 3-month supply. that gives you cost effectiveness and keeps the hormones from degrading. I gave this little pathway on the kynurenic and xanthurenic acid in case you wanted to look just a little bit closer at these pathways and how to modulate it and where the different vitamins and modulators go. I found it to be really interesting, so I wanted to share. Taurine is, again, really important. As you can see, these are all the actions of taurine that we've given you based on the different places and actions of taurine, all from research supported findings. So taurine does a lot in the body. It's extremely important. Again, my favorite. That is everything. I hope you guys got a lot from this, and I'm really excited that you're going to be using the 24-hour urine comprehensive ultimate hormone profile from Meridian Valley. It's going to help your patients. It's going to help you help them and have a better understanding of hormones. So please go out there and help all of those people that need your help and keep up the good work. I'm really proud to be here with you and be one of your colleagues.
For any questions or issues you may have, please contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Terra, for this informative presentation. Thank you again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics and Meridian Valley Labs, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.